Hi, welcome and good morning everybody. Really lovely to see you all here today. Thank you all for coming. So I'm going to take you through the first bit of the morning. My name's Siobhan Becker. I'm a GP in Oxford. And before you all think, oh no, great, we've got a bloody doctor telling us how to do our job. That's marvellous. Don't worry. I wrote the course with Lucy, who is going to be taking over from me at Coffee. She's a really experienced nurse practitioner who's done lots of district nursing as well. So we wrote the course together, and she is doing all the stuff that I have no business talking about, like wound management, ulcers, vaccinations, that kind of stuff. And I'm doing the chronic disease stuff that I do kind of know a bit about, but I'm definitely not straying into your territory, don't worry. So we'll do a good combination throughout the day of sort of chronic disease, vaccinations, wound management, that kind of thing, and we will alternate those topics. So I've been a GP here, I've been a partner here for, I'm trying to think the age of my children, about 15 years, and I've been a GP for nearly 20 years. So spent a very long time, like many of us, in the NHS, and sometimes we do feel a little bit like this poor chap in the middle, don't we, at the end of our working day. But what we always have are these people on either side, don't we? And I have to say, I'm a massive fangirl of the NHS anyway, but I'm particularly in love with it right now. I think we've seen incredible service from people in the NHS over the last few weeks and months, with loads of really terrible things going on. And at each time you've had one sort of awful event going on, you always get the stories of healthcare workers running to the scene to go and help people where everybody else is sort of fleeing very appropriately. And we've seen this real devotion of people who've dedicated their lives to working in the health service. It's made me really proud, I have to say, and sort of renewed my love all over again for it. There has been lots of really, awful, difficult news for us to manage recently, so I have got a little bit of a light-hearted campaign that I'm running for. I want Mary Berry to be the next Bond. Can we all get behind this, please? This is going to bring joy to everybody if we can get this going. So, a little bit about this course. Has anybody been on any of our courses before? Just a bit. Yeah, a few people. Okay, great. So, we've been doing a course for doctors for years and years, and nurses have always been completely welcome on the courses, but obviously it's not quite tailored to a nurse's role. So, we created this role because of people asking us, saying, actually, can you make it a bit more specific for practice nurses? And so that is indeed what we've done. So, Lucy and I started the course just over a year ago. There's a very broad range of skills that you all have, and a very broad range of topics that you do. So we've tried to encompass all of that. So what are you going to get out of the day? Well, hopefully you're going to come away feeling inspired about what you do and think, yeah, God, actually it's an amazing job that I do. There's such a huge variety of topics that you cover, huge variety of patients, and you should really rightly feel very proud about what you do, and I want you to come away sort of feeling like that. I hope there'll be some areas that you traditionally don't really go into. Maybe it's asthma or maybe it's diabetes, and you think after today, yeah, maybe I am actually going to do that. So I hope that you'll sort of feel that confidence to do that as well. Relax. You're not at work. Now, isn't that splendid? I mean, that just got to be a really good start to the day, hasn't it? Nobody is going to sort of say anything like, oh, good luck getting blood out of that. And nobody is going to ask you about their funny discharge at lunchtime. Well, I really hope that that doesn't happen. And no one's going to say, oh, could you just do a quick ECG for me? So hopefully it's just going to be a really nice, relaxing day. And what we really want you to do is interact as we go along. There is no pressure. No one's going to ask any questions of anybody. But it's really nice for Lucy and I to hear a bit about, your own experiences, to hear your questions. It helps us to tailor the course as we go along.